carnival costumes, and later on this year we'll all be going along to a carnival with our costumes on and jumping around and dancing about in the street with a big sign that says who we are and our bright, colourful, silk-painted costumes. We're all going to have a sarong and a flag and some sort of a top. Within the forum at the moment, we've got issues around the mental health care trust locally, making some quite large changes to their service provision over the next couple of years. And it is conceivable and likely that within the next couple of years there will be an increased number of young carers who are caring for somebody with a mental health problem as a result of those people with a mental health care problem predominantly being cared for more in the community. Either our existing young carers will have a greater level of responsibility, or some of our young carers who are currently unidentified will become known to us and we'll have to start working with them. And of course it will create some new young carers who are caring for people with mental health problems. One of the things we've managed to do is bring that to the fore and actually explain to the Mental Health Care Trust, while they're busy making all of these plans for the future, that there are other groups within the community that are going to be impacted on by their decisions. And hopefully it will mean that we will be able to put in place more provision for the young people and children. It will also mean that we'll be able to provide some training for the mental health care professionals to help them to identify young carers when they're out and about doing sort of locality team-based work as opposed to hospital-based work, so that the young carers can be identified earlier and receive more support at an earlier point before it gets to crisis point.